Hey everybody, my name's Jake and this is my 486 project on Alzheimer's disease. Alzheimer's is defined as a common form of dementia believed to be caused by changes in the brain, usually beginning in late middle age, characterized by memory lapses, confusion, emotional instability, and progressive loss of mental ability. Alzheimer's is a neurodegenerative disease, meaning that over time the brain starts to degenerate. Um, Alzheimer's accounts for 60 to 80% of dementia cases. It's the most prevalent form of dementia. Symptoms typically develop slowly and worsen with time, and those diagnosed with Alzheimer's live an average of 8 years with the disease. This is only because they're typically diagnosed with the disease so much later in life. They're in their 70s or 80s when they get diagnosed with the disease. So that the average is only around 8 years, which would put them, if they were diagnosed at 80, that's almost 90 years old. Um, People have shown to live more than 20 years with the disease, but it's typically those that get diagnosed with early onset Alzheimer's or Alzheimer's earlier in their life, and they're more prepared to fight this disease. They know what's ahead of them. And they're just more aware. They learn more about the disease and how it helps them. Okay, if you're going to understand Alzheimer's, you need to understand dementia first. Dementia is a general form for a decline in ability severe enough to interfere with activities of daily life. Dementia is a term for a wide range of symptoms. Dementia is just general memory loss. It's not a specific disease. It's not one thing. It's caused by damage to brain cells. There's all different forms of dementia. Alzheimer's is just the most popular form of dementia. The second most popular form is vascular dementia, which is memory loss caused by a stroke, typically, which that stroke earlier in their life causes them to have decreased blood flow to the brain, where that then has damage to brain cells, just like with Alzheimer's. Okay, so the cause of Alzheimer's currently is unknown, but we know that these protein fragments, beta amyloid plaques, and these neurofibrillar tangles are prevalent in all the biopsied brains of patients with Alzheimer's. And what happens is these tangles develop inside of the neurons, which you can see on the right here. And these kill the neuron from the inside out. And then on the outside, these beta amyloid plaques build up, and those interfere with neuron connections, so they're not able to send signals saying that they need food, they need nutrients. They're not able to communicate with each other. So what's happening here is the tangles are killing the cell from the inside out, and these amyloid plaques are on the outside, then making things worse. Another cause of Alzheimer's is genetics, they found, and also brain atrophy, which is the shrinking of the brain. Here's a picture comparing a normal brain with an Alzheimer's brain, the cross sections of them. And as we can see on this right portion here, the memory lobe and also the lobe responsible for language are much smaller in the Alzheimer's brains than with the regular brain. These portions of the brain are the first ones. These are in the first stages of the disease. These are the ones to be affected first. And then it develops over time to other regions of the brain. But since these are the first developed, that means that these are the ones that get hit the hardest, and they have the most shrinking and the most cell death, which is very obvious with this picture. And here we have a PET scan of a brain studying neurological functions with cognitive tests. This left here is a it's a normal brain with full cognitive function. You can see activity going on throughout the whole portion of the brain, even though it's small here and here toward the medial portions of the brain. And then as we go down the row, we have a mild cognitive impairment, which that would be the first couple stages of Alzheimer's disease. You can see how this portion is much larger on this right than on the other brain. And then down here, I don't know if you can see this or not, but this is the Alzheimer's brain, and this has the least amount of neurological function, and you can see how cognitive how it's cognitively impaired, and there's not much electrical disturbances going on in this middle portion of the brain here. Some symptoms for Alzheimer's include memory loss that interrupts the daily life, changes in planning or solving problems, difficulty completing familiar tasks at home, work, or leisure, confusion with time or place, trouble understanding visual images, new problems with words or speaking or writing, misplacing things and losing the ability to retrace steps, decreased or poor judgment, withdrawals from work or social activities, and changes in mood and personality. So they've broken Alzheimer's disease down into several different stages so you can compare them and see where they're at with the progression of this disease. The first stage is no impairment. This is why it's so hard to diagnose people in the very beginning because impairment's very little. They're forgetting like a thing a day. It's not noticeable. And stage 2 is with mild decline, very mild decline, 3 mild decline, 4 moderate decline, 5 moderately severe decline, 6 severe decline, and 7 very severe decline. And here we're able to see how Alzheimer's disease spreads to the brain. This left portion here is the early stages of the disease, which this can last for an average of 7 years. And what's being affected here is the medial temporal lobe, which is responsible for your short-term memory. And the symptom of it is short-term memory loss because this medial temporal lobe here is getting affected and you're not able to remember much of your short-term memory. And then later stages of the disease, it spreads to the lateral temporal and parietal lobes. And then these are where you get symptoms like reading problems, poor object recognition, and poor direction sense. Then the disease spreads to the front portion of the lobe, the frontal lobe, and you have symptoms such as poor judgment, impulses, and short attention. And then lastly, this is the most severe part of the disease, is when it spreads to the occipital lobe, which is responsible for your long-term memory, more visual problems. This is when hallucinations begin to occur. Okay, Alzheimer's is broken down into 2 different types. There's early onset and there's late onset. Early onset patients are typically less than 65 years old, and then this has been shown to be a genetic trait attached to a gene on the 14th chromosome. They're not exactly sure what in that gene causes it, but they're able to they're able to find a connection with that 14th chromosome. This is the most rare, and only 5% of Alzheimer's patients have this, and it's typically those with Down syndrome that have a higher risk for this. They don't know the connection or why there even is a connection, but they just have seen a connection with Alzheimer's and Down syndrome. Late onset is the most common form of this disease. It's everybody over 65, and they are unknown. They are unknown what causes it, but they're aware with those proteins that I was discussing earlier. So there's not one single test to diagnose Alzheimer's. It has to be a range of tests conducted by a doctor that knows about the patient, that is very familiar with the patient. They have to know them on a personal level almost, that they're able to witness the neurological the decrease just like a family member would. So they need an extensive medical history with the doctor. There also needs to be mental status and mood testing, which the doctor can then see how it worsens over time. Physical and neurological exams are conducted. This is like balance. A lot of late stage Alzheimer's patients have balance problems, which that needs to be our main focus when prescribing exercise to them, is their balance and also their forgetfulness. There's also needs to be tests to eliminate other causes of dementia-like symptoms, because dementia is such a broad thing that things like low blood sugar could have the same kind of symptoms as somebody with dementia, forgetfulness, that kind of stuff. Early detection is the best treatment of everything. While it's hard to detect early, if you get it detected early, you have the greatest. It slows down. It can help slow down the disease immensely. Um, it has the greatest benefits of treatment, which it increased participation in care decisions. That means you're able to you're able to tell them what you want done before you start to lose your thought process. So it makes it's just a better feeling for the family and for you. There's better chances of slowing down the disease with diet and exercise. That's been proven. There's also more chances to plan for the future. So this and your increased care decisions. They both help make you feel better about being diagnosed with a disease before it's uncontrollable for you. Okay, so let's look at our case study here. Marie is an 82-year-old female recently diagnosed with Alzheimer's. She is in the middle stages of the disease, with her memory starting to become noticeably worse. She is quite familiar with the disease because her mom lived with it for years. She worries about the gradual decline of her cognitive abilities. She also is very worried about falls because her friend passed away shortly after a fall that resulted in a broken hip. Her recent bone density scan shows that she has osteoporosis. Her BMI is 23. She has never been a smoker and tries to maintain a healthy lifestyle and go for walks in the park and bird watches. She has an LDL of 126 and an HDL of 57. Her resting blood pressure is 128/82. So let's look at her risk stratifications. Her age is certainly a risk because of how old she is. She has a family history. There is a family history of Alzheimer's disease. She's not a smoker. Does not have a sedentary lifestyle because she loves bird watching. She's not obese. There's no risk of hypertension, and her HDL and LDLs look fine. Other problems that you have to worry about with these type of patients is osteoporosis. With Alzheimer's patients, there's typically another disease that you have to worry about on top of it, whether that be hypertension, osteoporosis, depression. There's a lot going on with these patients. So you have to look at them on an individual case by case basis. So for exercise testing, in the early stages, you should follow the ACSM guidelines for your patients, but in the later stages, the ones where there's significant memory loss, it's unnecessary because it can confuse the patient and they can not understand the test, not know why they're doing the test, be confused in the middle of the test, get angry because of the test. There's a lot of different variables with that. But mainly what you want to look at if you do any kind of testing is neuromuscular with balance. But definitely test balance and range of motion, flexion, extension, abduction at all your joints. Check the the degrees of range of motion that their patient's able to go through. To prescribe exercise, aerobic, the frequency should be 4 to 5 days a week with an intensity of 3 to 5 on a 10 RPE scale. The time is a goal of 40-minute sessions, and if it's combined with strength training, you want to drop that down to 20 minutes. And the type should be low intensity exercises because of that osteoporosis. You want to have things like walking, cycling, seated aerobics, swimming. For muscular strength, the frequency should be 2 to 3 days a week, an intensity of 50 to 70 of the 1 rep max, and 20 to 40 minute sessions. This should be done with functional exercises, therabands. You want to work on postural muscles so they retain that muscle memory and that doesn't deteriorate over the course of the disease. Flexibility should also be looked at with 3 to 7 days per week. Intensity should be just till slight discomfort. Time 15 to 30 seconds, and it should be done with either static or partner stretching. And then neuromuscular should be 2 to 3 days a week. The intensity should be within safe limits because they are very fall prone. The time less than 60 minutes per week. Working on balance, coordination, and gait. And in conclusion, Alzheimer's is a slow, sad, incurable disease, but with diet and exercise, it's been shown that you can slow the disease and make it better for the patient. Thank you.